Welcome to Beyond the Scalpel. I'm one of your hosts, Dr. Elie Lehr.
And I'm your other host, Dr. Jody Levine from Plastic Surgery and Dermatology of NYC. You can learn more about us at plasticsandderm.com.
We have an exciting show ahead.
Of course,
Our guest,
Leslie Lehr, author of
A Boob's Life.
A Boob's Life. That's exciting.
Yes.
And today we are going to talk all about breast augmentation. So breast augmentation surgery is very popular. In 2022, it was the second most popular cosmetic surgery, the number one being liposuction. About 300,000 procedures were performed that year in breast augmentation. And there's a lot to talk about.
There is. And whenever I see a patient in consultation, it's one of those things where I say, there's a lot to cover. Let me give you a bit of background information, jump in if you have specific questions. And I would say it takes me about 20 to 30 minutes just to talk about all the details. And I'd like to believe I'm pretty thorough because it's very rare that there are a lot of questions afterwards because there's a lot to talk about, but a lot of this stuff is straightforward.
So can I ask some questions?
Ask away.
Okay. First of all, tell us about the different kinds of implants and what are the benefits / risks to each.
Right. So there are two general groups of implants available on the market today. There are saline implants and there are silicone implants. And even the saline implants, just kind of picture them like a balloon, but they're not. They're better manufactured than balloons, so they last longer. The outer shell is made of solid silicone. And then there are silicone implants that are known as silicone implants, where not only is the outer shell made of silicone, but the inner contents is silicone as well.
Okay.
I would say that it has probably been at least 7 or 8 years, maybe close to a decade since I've put in a saline implant. And there's nothing wrong with saline implants. It's just that there are a few potential problems with them. So number one, if someone is going with a moderate to larger implant, it will definitely feel a little less natural. No. And with time, they begin to look a little bit less natural. So that's kind of one issue, which is like kind of the main issue, which is why very few people choose saline implants. And I'd say that even 7, 8 to 10 years ago, when people were choosing saline implants, it was generally someone coming in saying, my mom, my sister, my friend had saline implants. They're very happy with them. I want to do that. And the saline implants I put in, people have done great with them. But the vast majority of people are using silicone implants. And the reason why they're using silicone implants.
Wait, before we get to that, why would someone want saline?
So, good question. So there is an understandable fear of, is silicone safe? And the short answer is that silicone is safe. The slightly longer answer is that there have been discussions regarding silicone implants going back to the 1980s. And there were essentially a bunch of cases where people thought they were developing autoimmune diseases or other kinds of issues relating to silicone implants. And they were actually pulled off the market for a large number of years. And what's interesting is they were essentially pulled off the market in the US, but used in other parts of the world. And they did broad, large spectrum studies following patients for many years. They pretty much determined that those things were really unrelated to the implant. And so they were essentially brought back on the market with kind of the following caveat, is that it's kind of a weird caveat that I've never really heard a great explanation for it. So, for example, and this, we're kind of jumping ahead a little, we'll come back to this later. If silicone implants, not saline, so saline implants, if you come in over the age of 18, coming in saline,
yes,
for cosmetic purposes, you can proceed with a saline implant if you and the practitioner feel like it's right for you.
Okay.
Silicone implants you cannot put in unless someone is over the age of 22, unless there is a reconstructive purpose to it.
Okay, so legally, you are not allowed to put a silicone implant in anyone under 22.
Unless it's for reconstructive purposes.
It's for reconstruction. So that is a very good reason why people would choose saline.
Correct. And it's also kind of a weird number because like 18, there are a lot of things that we have 18 designate certain things, voting age and certain things, driving. 21 is also a big age. 22 is an age for nothing other than for silicone implants. Right. And I've never really heard an explanation why it's not 21. Yeah. I don't know. It is. It just is what it is.
So now we know why someone would choose saline.
Right.
So now tell us all about silicone.
Silicone implants look and feel more natural. And in fact, I would say that if placed properly, they feel like normal breast tissue and they could fool anyone and everyone.
Wow.
And so that's why the satisfaction rate is so high for silicone implants,
Okay.
and more people choose silicone implants.
Okay, that makes sense.
Yeah.
Now, I know there are lots of different ways in which you can place the incision in order to put in an implant, right?
Right.
I know around the nipple is one option, under the breast, under the armpit. So how does one choose?
So theoretically, there are 4 options. Now, if it was back in the days where people were doing a large number of saline implants, you could go in through the belly button, which is a procedure that I've done a number of times. I don't particularly love the approach.
Okay.
And I don't love the approach because I feel like you have less control of where that implant is placed. Now, what's interesting is if you go to 10 plastic surgeons and you ask them, should you go through the belly button? Almost all of them will say it's a terrible approach.
Right.
I find somewhat comical is I would say that I'm probably less than 10% of practitioners have actually put in an implant through that approach. So those other 90% of practitioners are saying it's a bad approach are saying that without actually having done the operation.
They've never tried it.
Which I just find comical. And one of the things that I wanted to do early on in my career, and one of the reasons why I did a cosmetic fellowship, because I wanted to really understand these things, not just like talk about them without any actual knowledge, but actually coming from a place of knowledge. And I kind of roll my eyes when I hear practitioners who I know with certainty have never even been in an operating room where the operation was done, talking about it as if they're an expert on it.
Now, I imagine the reason someone might request that is because it hides the scar in your belly button.
Well, correct. The problem with it is that, you know, an implant scar can be really small. It can be as small as an inch, especially for, say, an implant. But an inch incision in your belly button is actually not a very small incision.
Okay.
Now, when I was putting in a lot of saline implants, one of the approaches that was commonly asked for was through the axilla, through the armpit. And what was great about that approach was that there was no scar at all on the breast.
Makes sense.
Yes. And I can tell you as a practitioner, it was kind of fun to do the operation that way because you're using, you know, oftentimes an endoscope and all kinds of other kind of more complex things. And not everyone could do this operation. It was really enjoyable. I did kind of scratch my head about it because on the one hand, you kept scars off your breast. On the flip side, if you were on a beach, if you were wearing a tank top and you raised your arm, it was not a bad scar, but there was a scar underneath the armpit. And it was a scar that someone would see. And so I would say that nationally at this point, the most common approach for operations is underneath the breast fold. And it sounds great, especially if you have a pretty prominent fold.
Right.
I would say that and it's a very easy approach for practitioners. It is definitely the easiest approach for practitioners.
And it looks just as natural and it gets placed in the right place.
Correct. All good things.
Okay.
I don't love that approach. And I do that operation if someone wants it. And it's not a bad operation. But the reason why I don't particularly love it is, not surprisingly, most people who undergo breast augmentation don't want to necessarily brag about it, especially my patients. They want it to be a little bit more conservative. They want it to be subtle. They want to, you know, look better in and out of clothing, but they don't necessarily want to brag to the world that they've had this operation
And
done.
this is bragging because you see the scar.
Well, here's the thing. If you're sitting on a beach and you're wearing a 2-piece bathing suit and it rides up just a tiniest little bit, someone could see that scar. And if they see that scar, they know exactly what you did.
Or if you're laying on your back without clothing on, you'll see it.
So my favorite approach really is through the bottom edge of the areola. And it's a tiny little incision.
The areola being the red part of the nipple. Okay.
Yeah. And even a week out, you can barely see this scar. Now, the reason why I really like this approach is 2 reasons. One is you could wear the most revealing clothing ever, and no one sees that scar.
Yeah.
But the other is that if you look at the edge of your lip, it's a very precise line. And if someone got a cut there and I didn't line it up precisely, you would see that, and it would be very noticeable. The edge of your areola, the edge of your nipple, from a distance looks like a circle or something like that. But if you look up close, it has irregularity.
Yes, it's not a perfect circle.
It's not. And when you put in a scar in an area with irregularity, it camouflages brilliantly. And so that is a little bit harder as a practitioner, not particularly for me, but for a lot of people.
Okay.
But works brilliantly.
Okay. Now, one burning question I have is breastfeeding.
You should still be able to breastfeed with any of these approaches.
Okay. Even if a cut around the nipple will not cut off the milk ducts?
Correct. So I'm not actually I'm cutting through that bottom edge, but then I'm immediately, once I'm underneath the skin, tracking down, far away from the nipple. So I'm not trying to cut under the nipple. I'm kind of trying to go away from it.
That is very important. So the actual skin cut is around the nipple, but you're not cutting around the nipple deeper down.
Correct. I'm actually moving away from there.
A lot of sense. Okay. The other burning question,
yes,
as a woman, does an implant affect the ability to catch breast cancer?
So great question. So the again, something that has been well studied, and these are not the types of things, because these are all great questions, because is this safe to do? Are there downsides to it? Are there risks associated? And what's interesting is that, just to kind of bring all the data together, There is not a higher incidence of missed breast cancers, of later stage breast cancers, of more severe breast cancers as a result.
Okay.
And the technique of doing mammograms is slightly different, but there are some that will actually argue that, especially in smaller chested women, which is a large number of women who undergo breast augmentation, that by placing the implant underneath the muscle, we can talk about approach a little bit in a second, it essentially pushes the breast tissue forward.
Yes.
It sometimes makes it easier to pick up things on mammogram.
I heard that,
Yeah.
that it's easier to detect the breast cancer on mammogram if you have an implant.
So it definitely is not a negative effect. Some would even argue that's even of benefit.
Wow, that's very interesting.
Yeah, it is. And
Okay.
yeah.
All right, so tell us a little bit about the recovery. How soon after you have an augmentation can you be up and about doing your daily activities?
So it somewhat varies from person to person, but I generally tell people describe this procedure as something that is uncomfortable more than painful. So I do prescribe pain medicine. If someone sleeps easily, they'll sleep brilliantly the night after surgery. If they're a light sleeper, using some sort of medication as a sleep aid is a benefit.
Okay.
But I'd say there's an element of soreness, like you had a really intense workout for about a week, and after that it passes. I have some people that are working right away, especially if they can work remotely in the post-COVID era, right away the day after surgery. Even people that are going into the workplace, I live about a week at most.
About a week at most to stay home?
To stay home.
Okay.
But there are a lot of people that are back at work even a day or two later. It's really quite remarkable.
I imagine it has to do with the kind of job you have, right?
So correct. So if you're working a desk job, there are some people that take a week off. There are other people that take almost no time off.
Right. You're capable of going back to a desk job the next day.
Correct.
Okay.
And again, if you're not great with pain, each person's a little different. If you're great with pain, you could be back at work the next day.
Right.
If you're not great with pain, you will take up to a week off. Even people that will describe themselves as big wimps, I'm a big wimp, for example, you don't need more than a week off from this kind of procedure.
Right.
Now, if you work in a job where it's very labor intensive, so you could be, hanging telephone lines for Verizon, or you could be working in any setting where you're,
like stacking shelves,
anything
like
where
you're lifting your arms, I imagine.
Correct. I generally will tell people to take about 2 weeks off.
2 weeks off if you have an active job.
Correct.
Okay, that's fair.
Yeah.
And when can you be in clothing and look normal? I imagine that there's a lot of swelling involved.
So interestingly, there is swelling. But it's not swelling that someone would notice in clothing.
Okay.
I pick patients wear we'll call it a sports/medical bra. Okay. It's not bulky. It's not cumbersome. It's not unusual. You could wear it with any clothing item and no one would notice it looking different. So literally the day after surgery, if you put on a blouse, no one would notice that you had anything procedurally done. Will you be a little bit sore? Will you be a little nervous to kind of necessarily go out and bump into someone? Maybe physically.
Right.
But you actually are quite presentable right away.
Interesting. I have heard from many women that the discomfort in the first few days after breast augmentation is similar to the discomfort of feeling breast engorgement when you're nursing.
So I haven't had either.
Like it's a swelling, a sensation of swelling.
Yes.
And when you nurse, and you're trying not to nurse anymore, it does help to wear a tight fitting bra to hold in the
So I'm not necessarily a fan of a tight fitting bra. It needs to be supportive so you don't feel vulnerable. But at the same time, it doesn't have to be one of these punitive kind of things where it's so tight that feels like a tourniquet or anything else like that.
Okay. So tell me, who is not a candidate for breast augmentation?
So it's not so much who's not a candidate for it, which, obviously there are people that aren't candidates, but there's a few things that you have to kind of factor in. So number one, being an active smoker, and smoking really encompasses anything from tobacco to marijuana, that has significant impact in terms of wound healing. So that's a major problem. Now that's the bad news. The good news is if you avoid those products from about 6 weeks before a procedure to 2 weeks afterwards, you do great. But that's something that you must avoid.
6 weeks, no smoking.
Yes.
Okay.
In general, when you talk about someone being a great candidate for surgery, you just want to make sure they're in good health. They need to have, pretty much normal blood pressure or well-controlled high blood pressure.
Right, definitely.
If they're an uncontrolled diabetic, it's a problem. There are medical reasons why one would kind of consider someone not an ideal candidate, and those things can be optimized before surgery.
Okay.
The biggest kind of discussion when it comes to who's not a candidate is women who've had children. It's very variable. There's some women who've had children where they come in, they may have had anywhere, let's say from 2+ kids, and you examine them, and they may be a candidate for breast augmentation.
Right.
But there are others where what they really may benefit from is a breast lift.
Right.
Or a combination of a breast lift and an augmentation. And it really is very patient dependent.
Right.
Breast lifts are a great procedure. They can be combined in the right person with a breast augmentation, but we're not talking about little scars anymore.
Right.
We're
Those are
talking
bigger
about
scars.
bigger scars, and breast scars generally heal quite well, even across the board, even in people that will describe themselves as not great healers.
Right.
But it's not a scarless procedure.
Yes.
And there are some people that will come in and say, this is what I want and need. This is what's going to kind of be the right procedure for me. And there are others that are like, just not putting those scars on my chest. And these scars are well hidden.
Yeah.
You can show your cleavage. You can show the outer silhouette of your chest. You can wear very revealing clothing.
You're talking about breast lifts now.
Even breast lifts.
Yes. Well, let's do a whole episode on breast lift.
Fine.
Okay. Back to our augmentation, though.
Yes.
I still have some
Keep me
questions.
focused.
Yes. My other question is with regards, let's go back a little bit to what you said about you can get a saline implant at 18, silicone at 22. Talk to me about transgender surgery.
Right. So gender affirming surgery.
Gender affirming surgery.
Yes.
Thank you.
So breast augmentation is for many people a great operation for them, and is remarkable helpful in their journey. There's no
Okay.
question.
And are you allowed, is there an age at which you are not allowed to perform a breast augmentation?
So the short answer is no. What it really comes down to is there's an element of reconstruction here.
Okay.
So the justification for using a silicone implant in a younger patient can be justified. And there are
Okay.
other conditions and other medical conditions, even separate from gender affirming surgery, that one could justify using a silicone implant.
Okay, so if you are 18 for gender affirmation surgery, you want breast augmentation with a silicone implant, you are allowed because it's
Yeah.
considered reconstruction.
There's definitely, you could justify it with an element of reconstruction.
Got it. Okay, wait, another question.
Yes.
Is it covered by insurance?
So more often than not, yes. But I'd
Yes.
say more and more insurances are covering it. And it's really great because it really is making a big difference for a lot of people.
Okay.
There have been a handful, interestingly, the few times where there have been exclusions in policies, and it's an interesting thing, and I have a feeling with time it will disappear, this exclusion. But there have been exclusions out there. I've had a few patients that have come in that are college students, and their health insurance is through their college or university. And one of the exclusions is gender affirming surgery. And I can't necessarily speak to specific universities. I don't think it's across the board.
So the university will not pay, the university insurance will not pay for that
Certainly.
surgery.
I've come across that a handful of
Okay.
times. Now, I imagine that in the coming years that will disappear because I have a hard time seeing how universities can justify doing that.
Yes. So it's just to summarize this before we talk to our guest who is ready for us. If I am an 18-year-old girl and I'm very sad about my chest, it affects my self-esteem, I want a larger chest, I want a silicone implant, I'm not allowed to get it. And it's not covered by insurance.
Definitely not covered by insurance.
Even though it's psychologically hurting me.
Yes.
Okay. But for gender affirmation, it is covered by insurance.
Yes.
And you can get silicone.
Yes.
It's very interesting.
It is.
Okay, let's wrap up our breast augmentation podcast for now.
One tiny little thing.
Yes.
So there are, and it's not the vast majority of people that are coming in for breast augmentation, but there are a small number of patients who benefit from, in addition to using an implant, adding in a small amount of fat grafting.
Oh, that's right. That's right.
So if you're looking for kind of large volumizing, fat transfer, I don't feel is the ideal approach. But if you're looking to just kind of complement things and just subtle improvements in addition to the implant, fat transfer, for many people is a great
so interesting
option.
We should talk about that in another podcast
We
as
could
well.
talk about fat for an entire time.
Okay.
We'd like to welcome to the show Leslie Lehr, author of A Boob's Life: How America's Obsession Shaped Me and You. Pretty amazing topic to join in for this. So welcome and thank you for joining us today.
My pleasure. Happy to talk about boobs anytime. Especially
So tell us about A Boob's Life. What is it about? I did not read it, but I will now definitely read it. I'm very intrigued.
Yeah, well, it started when I got out of the mirror once, a couple years after I had breast cancer, and I thought everything was fine after all these surgeries. And I was so upset that my boobs still weren't perfect. And my husband accused me of being obsessed. And then this comedian on TV made a boob joke. And I thought, okay, I am not the only one who's obsessed. And I wanted to know why. So I essentially went back to when I was a little girl and traced my life and how every woman's life is really shaped throughout all how our breasts change and everything that happens to them and how we hide them or show them or this or that. And was able to use the lens of my life and my breast to really look at the culture and the history and how America especially treats women and according to our bodies and how breasts give us confidence and how it changes through our life. So it's essentially, it's a memoir, but it's a lot of pop culture history with a lot of facts woven in. So
That is interesting. How did
yeah,
you do the research to
I,
get the history on boobs?
it was so fun to do. I actually just thought of every subject I could having to do with breasts, from Miss America to Playboy to breastfeeding to, baby formula and my mother's generation. My mother had given me breasts. She encouraged me to get a boob job after I was divorced because I was like, had Eeyore breasts and the whole thing. I mean, my whole life when I was little, how you have to cover your nipples even though you don't have breasts because they're taboo. And then
Right.
the whole generations, I grew up, my dad had Playboys, and then you want breasts and you get them and you hide them. I essentially had a folder for each topic I could think of, 21 different topics, and
Wow.
just kept adding research. And every day in the news, I now have a Google Boob alert. It's like every day there's boobs in the news. And I was just kidding before the show because InStyle magazine now says boobs are in, and it's like, okay, boobs, are they ever not in? And we
Right.
watch all the celebrities and they're showing their boobs, and is it exploitative? Is it empowering? And then I learned some really interesting scientific facts, like men will look at a woman's chest within 200 milliseconds of entering a room. And there's
Wow.
biology to that because men are looking for people who can carry their children. And yet in the United States, with Hollywood and the advent of advertising and television and Playboy, it was this perfect storm that took advantage of that biological instinct. And I think ever since then, breasts have been for sex, not as just for children, especially in the United States. And so it led, and then at one point, you probably are aware, the FDA said small breasts were a disease, and it opened up insurance for, there's all kinds of, it took just until recently to get insurance, as you know, to cover breast reductions. So this whole thing, it has shaped women so much, our lives, and women hardly ever talk about it, but we all have our boob stories. So I just thought it's really fascinating to know how, it affects our lives.
Wait, can we go back to that? I was not
Sure.
aware. The FDA said that small boobs are a disease?
The Plastic Surgeons Association got approval from the FDA during the 80s to say that, which opened up a whole new category. And I don't think it lasted long, but it was just this process that they want to say this is okay. And there was a time when you had to show your boobs to be a celebrity or, and to do various things. And now it's things have calmed down a little, and yet people don't understand. And as a breast cancer survivor, people think, oh, that's just an excuse to get a boob job. And I didn't get a boob job because of breast cancer. I had a lot of operations in and around it. But it really, when you're a woman and then you feed your babies and then your breasts look a different way and people expect you to look like you never fed your babies, it's
Right.
a very deflating ego thing. And men definitely are attracted to a certain thing. And we have to live in this culture. So there
Yes.
are certain things, as you know from your business, that give women confidence. And I feel like women, then if your boobs are too big, you're a bimbo. And if you're flat, you're an intellectual. And,
Right.
there's so many challenges with our breasts. And I was listening to another podcast you guys did about how women are going a little smaller. And, now there's mommy lifts and menopause makeovers. And it is a huge part of our identities. Our bodies are, and there's just no denying it. So I really wanted to go and figure out why. I mean, every morning we have to make a decision of what kind of bra to wear or not,
Right.
especially during COVID, or if you're wearing sports bras or, up or down, or it's just a huge subject that had not been tapped yet. So I thought I can do this.
That's fantastic.
One of the things that I've seen in the last number of years, which is a good thing, is that I would say that a decade ago, probably about a quarter of the women coming in seeking information on breast augmentation brought with them a partner, oftentimes a man, who you could almost tell was driving the consultation and driving, why they were there. And it was uncomfortable for me because at the end of the day, the patient coming in is my patient. It's not their partner. It's not their spouse. It's not the person who's with them. It's, if they're going to proceed with something, any kind of procedure, but especially this, it should be for them and it shouldn't be for that other person. And what I've noticed over the last number of years is even like seemingly happily married women are coming in without their partner because they're coming in for themselves. This is something they've wanted to do or wanted to explore. And it's a much healthier way. It's a much healthier consult. And it just, in the end, I think it's just the right thing. And it's nice to see that I'm seeing that more often.
So you think in the past, sorry, go ahead.
No, I was just say statistics do show that men who encourage women to get breast implants, those relationships tend not to last. You know, it is surgery. Some people have issues with immune systems. I mean, if you're not good enough. And my first husband, I remember saying, "Should I get a boob job?" He was like, "No." And then, but I wouldn't mind. And I was like, okay, now I'm never going to feel like enough, you know. And then when I actually had implants, I then started to date, and I was so afraid to let him know. Because it's like, oh, I'm not real. It's like, and I almost broke it off, you know? And of course he didn't care. He said breasts are like pizza. It's all good. So yeah, but I agree with you. It has to be a woman's choice. It's our body. It's just like anything we do to ourselves, injectables or even diet and exercise. If someone tells us to do it, that's not a good thing. It's really our decision in our lives, and we need to have control. And unfortunately, you know, we're judged by our bodies. It holds us back in a lot of different ways. And so it's really important to take ownership.
Yes. So tell us about your personal journey. How long after you had implants did you find out you had breast cancer?
Oh, let's see. It was probably about 6 years. And that was the first thing I thought. I went to my doctor and said, is this? And he was like, absolutely not. Zero relationship. And he even said, and I can save your implants. And I was very happy, although then, you know, I had radiation and everything changed and they got a little wonky. But it wasn't related at all, but it was a big deal for me in terms of, honestly, when I got them, I thought my mom wanted me to do it forever because she just thought I was deformed or something because she had never seen someone who had nursed, you know, and I was like, it's very strange. But ultimately, I kind of did it impulsively because I wouldn't have done it otherwise. There was an opening. And then I honestly I did feel so much more confident after that. I got jobs. I started looking men in the eye. I didn't show them, but just knowing that I could fill out a pretty bra and fill out a bathing suit, you know, instead of always being, oh my God, I'm so flat, but my nipples are going to show. And you know, having to wear clothes that I couldn't wear. And it was very exciting it just gave me confidence really, because I felt more womanly and more sexual. So that was my journey. And then when I had cancer, it was like, oh my God, that was a whole different deal.
Right. Oh, what an emotional roller coaster.
But I honestly I wasn't mad at my breast. It was like losing my hair was much worse than my breasts. So it wasn't, breasts were something I was always going to have one way or the other, you know, my whole life. And I have 2 daughters. So then it was like, do you want to be good influence or bad influence? But it's really all about, you know, like you said, doing what the woman wants to do with her body, being in control. And beauty we can't avoid beauty being important in life. It's just how
it's a reality.
Yeah. You know, it's interesting your mom's perspective on this because not surprisingly, in our line of work, if we're out to dinner with people or in social settings, people want to talk about this stuff in general. And there are such diverse views on this. There are some people that are like, if your chest looks terrible after having kids, you should be thrilled with that. And I'm like, maybe you should, maybe you shouldn't. That's a personal choice. And there are other people that are like, why be unhappy with it? You know, do something about it. And again, for each person, there's no right or wrong answer.
But her mom did not nurse, right? Your mother didn't nurse.
Absolutely not. She was in, you know, earlier generation when formula was supposedly a big thing. And, you know, she was very proud of how she looked. And so for me, it was like, oh my God, and how am I going to attract a man and stuff like that. Then when I had breast cancer, you know, I think what I was getting at earlier is I was surprised that I thought, oh, most people had implants was because it was reconstruction. And actually, when I got mine, he said, oh, this is reconstruction. And I felt, oh, that made me feel better that it was an actual ptosis was an actual condition, you know? But I didn't know there are so many options, and most of the augmentations aren't from breast cancer patients. They are elective surgery for women who wants to have them. And a lot of breast cancer patients don't have reconstruction, or they get tattoos, and there's so many options. And I completely agree with you. It's absolutely individual.
Well, this has been really, really interesting. I'm sure your book is phenomenal, and I'm sure it resonates with everyone.
Yeah.
Women, men.
Boobs, and people who like boobs. Yeah.
Yeah, exactly. Okay.
Well, thank you so much for joining us. It was great having you on the show
My
today.
pleasure. Thank you.
That concludes today's episode of Beyond the Scalpel. To follow us, please reach out to plasticsandderm.com.
Thanks, and we'll see you here next time.